Hello, I'm Tristan and I'm the Acute Liaison Nurse at the Norfolk and Norwich University Hospital Trust. There are acute liaison nurses or people in similar roles in hospitals across the Eastern region. Our job's developed as a response to the 2006 Mencap report, Death by Indifference, which highlighted the cases of 6 people with learning disabilities who had died in NHS care. Their research showed that there was widespread ignorance in NHS hospitals about the needs of patients with learning disabilities and the adjustments needed to ensure that they get equal access to good health care. I've been doing my job for over 3 years now. I work with staff across the hospital to help them make their services more accessible to people with learning disabilities and other vulnerable patients. My work falls into 3 distinct areas. The first area is clinical advice and support. I work with individuals, their families and carers in preparation for admission or at outpatient appointments. I liaise with the clinics, ward teams, consultants and GPs and community teams. I facilitate pre-operation visits and help with risk assessments, capacity and consent issues. The second area of work is training and education. I teach awareness training in learning disabilities and autism to staff across the disciplines. For example, medical staff, nursing, therapists, porters, receptionists. I do a lot of training around the Mental Capacity Act, advanced communication and dealing with behaviours that challenge services. The third area of my work is strategic. I help the Trust to put in place protocols and policies to support patients with learning disabilities. I sit on strategic groups like Equality and Diversity and Safeguarding. I'm also a member of the local Partnership Board's Health Subgroup. This group plans and sets targets to improve health outcomes for individuals with learning disabilities across the county. I love my job. I've worked with people with learning disabilities for over 20 years. Being an acute liaison nurse in a hospital allows me to use all my skills and experience to improve the services for patients with learning disabilities and to increase the confidence of the staff who work with them. It's a real pleasure seeing colleagues take on board the things they've learnt and to start to think outside the box, to see patients with learning disabilities as a whole person and to ensure the right adjustments are in place to meet their needs. The key thing I want you to remember from my film is that I'm not responsible for every patient with a learning disability who comes into the hospital. It's everyone's responsibility. My job is to give advice and support and ensure all the staff are aware of their needs. Sometimes it's just about confidence and taking the time to know the individual. Good luck.